بسم الله الرحمن الرحيم.
السلام عليكم ورحمة الله وبركاته. إن شاء الله هنتكلم على gastrointestinal tract من حيث development and anatomy. Development of gastrointestinal system. We will start in the developing embryo, the three-germ layer before folding. Before folding, we have two sac or two cavities, amniotic cavity and the yolk sac related to the ventral aspect of the embryo. This is before folding. After folding, the yolk sac will be incorporated inside the developing embryo in the head fold, in the tail fold, and in the middle part, and change it to foregut the cranial part, midgut the middle part, and hindgut the distal part or caudal part, and the developing gut will remain connected with the remnant of the yolk sac through what's called vitellointestinal duct. Derivatives and the blood supply of the foregut. The foregut will give rise to laryngotracheal diverticulum, ودي اللي هتكون development of the respiratory system, will give rise to the primitive pharynx and esophagus, stomach, and upper part of duodenum, developing hepatic bud and the developing pancreatic bud, اللي هم هيكون the origin of the pancreas and liver. The arterial supply of the foregut will derive from the aorta through celiac artery, and to the midgut the arterial supply is inferior mesenteric artery. For the hindgut the inferior mesenteric artery. بالتالي celiac for the foregut and its derivative, superior mesenteric to the midgut and its derivative, inferior mesenteric to the hindgut and its derivatives. Congenital anomalies of duodenum: atresia, failure of recanalization. Failure of recanalization of this part result in esophageal atresia or posterior deviation of laryngotracheal diverticulum. This laryngotracheal diverticulum will deviate posterior to obliterate the tube posterior to it, which is the developing esophagus. Stenosis, incomplete recanalization, incomplete removing of the obstruction in the tube result in stenosis or narrowing of the developing esophagus. Short, failure of elongation of the esophagus result in short or small esophagus which will pull the stomach upward through the diaphragm. Megaesophagus, enlargement of the esophagus or elongation of the esophagus due to presence of a ganglionic segment. Tracheoesophageal fistula, development of the primitive respiratory system or primitive trachea is anterior to the developing esophagus, so there may be connection between both roots called tracheoesophageal fistula. ودي الصور اللي بعد الكونجنتال انوماليز زي الميجا اسوفيجاس وزي الاسوفيجيال اتريسي. development of stomach زي ما اتفقنا كده الستومك developed from the foregut. At first it is simple tubular structure, tube عادية خالص continuous with the developing esophagus. After that fusiform dilatation change it to fusiform in shape. Then it form dorsal border towards the posterior side and ventral border towards the anterior side. After that the developing dorsal border will form the greater curvature and the developing ventral border or ventral border will form the lesser curvature. At first the greater curvature directed posterior and the lesser curvature directed anterior. After that rotation of stomach, the stomach rotates in relation to the liver and in relation to its horizontal axis to change the position of greater curvature which come from posterior to inferior lesser curvature. After being anterior change it to the superior position. Anomalies of stomach: congenital hypertrophic pyloric stenosis, narrowing of the pyloric part or failure of its recanalization. Thoracic stomach, it's due to short esophagus which pulls the stomach upward through the hernia in the diaphragm or pulling it upward to the thorax. Hourglass stomach, incomplete or abnormal recanalization or dilatation of stomach, transposition of stomach. The rotation of stomach in this case will occur in opposite direction, which make the greater curvature toward the right side. Gastric atresia, failure of recanalization of a certain part, not similar to the congenital hypertrophic pyloric stenosis. This area is related to congenital hypertrophy in the sphincter, while this area is failure of recanalization of the lumen, complete or membranous or luminal. زي ما قلنا قبل كده blood supply بتاع الجزء اللي فات ده اللي هو الديودينم واللي هو الاسوفيجاس والاستومك بيبقى derived from the celiac artery. برضو الديودينم بيبقى supplied from the celiac artery in its upper part and its lower part supplied from superior mesenteric. why؟ ليه في change في blood supply of duodenum؟ لأن الديودينم السورس بتاعه أو المصدر بتاعه في الديفلوبمنت حاجتين، الفورجات and الميدجات upper part from the foregut و middle part till the point of entrance of the bile duct and the lower part behind the entrance of the bile duct will develop from the midgut. Anomalies of the developing duodenum, duodenal atresia or duodenal stenosis. Next part in the developing gastrointestinal tract is the midgut. Midgut is the area. Derivatives on the midgut begin after the midpoint of duodenum, including lower part of duodenum, jejunum, ileum, cecum, vermiform appendix, ascending colon, and right two-thirds of transverse colon. This area are related to the developing midgut. So what are the derivatives of the developing midgut? Duodenum, but not all duodenum, small part distal to the opening of the bile duct, jejunum, ileum, cecum, vermiform appendix, ascending and right third of transverse colon. Blood supply to the midgut زي ما قلنا قبل كده. Blood supply to the midgut derived from superior mesenteric artery. Anomalies in the midgut: congenital omphalocele, umbilical hernia. Anomalies in the rotation of the midgut: non-rotation of the midgut, which makes the small intestine towards the right side and the large intestine towards the left side. Reversed rotation of the developing midgut loop, which makes the duodenum anterior to the transverse colon and the superior mesenteric will lie anterior to the transverse colon and posterior to the duodenum. Anomalies in recanalization of the midgut, which result in stenosis or atresia, like that. This is the developing obliterated intestinal loop. Normally it is canalized and completely opened. This is the normal recanalization of the developing intestinal loop. This recanalization may be incomplete, result in stenosis. The recanalization may be incomplete or absent, result in complete atresia. Failure of recanalization result in atresia. Anomalies in the yolk sac remnant. زي ما عرفنا قبل كده ان اليوك sac هو developing gastrointestinal tract ما عدا جزء بسيط بنسميه definitive yolk sac and remain connected to the midgut through vitellointestinal duct. لو الفيتيلوانتستينال داكت دي فضلت موجودة كلها بيبقى في كونكشن ما بين الديفلوبينج ميدجت أو ما بين الميدجت بقى أو الانتستين أو اللارج انتستين and the umbilicus. This is named vitelline fistula. If the middle part of the vitellointestinal duct remain opened, it forms a vitelline cyst. If the distal or proximal part remain opened, it will form what's called Meckel's diverticulum. أحد الأنوماليز برضو ميدجت فولفس نتيجة الابنورمال روتيشن. الجزء الأخير من الديفلوبينج gastrointestinal tract is the developed hindgut. إيه الأول؟ إيه هي الديريفاتيفز بتاعت الهايندجت؟ طبعا بقية الأجزاء زي left one third of transverse colon, descending colon, sigmoid, rectum and upper part of the anal canal. وكمان بيشارك في بعض أجزاء اليورينري سيستم زي epithelium of most of the urinary bladder and most of urethra. ده ال developing hindgut. This area is responsible for all of these derivatives. Blood supply of the hind gut بيكون من خلال inferior mesenteric artery زي ما قلنا في أول صورة خالص. ال blood supply to the foregut celiac, ال blood supply to the midgut superior mesenteric, ال blood supply to the remaining part or derivative of the hind gut derived from inferior mesenteric artery. Process of development of cloaca, terminal part of the hind gut. في الأول الكلواكة بيحصل لها partitioning and closed inferiorly by what's called cloacal membrane, the connection between the endoderm and the ectoderm. This is the cloacal membrane. Cloaca completely obliterated by what's called cloacal membrane. This is the developing urinary system, mesonephric duct. Urorectal septum developed in the middle of cloaca and started to develop distally toward the cloacal membrane till it completely separates the cloaca into two parts. Anterior part is primitive urogenital sinus وده الجزء اللي هيبقى فاتح فيه الميزونيفريك داكت اللي كنا اتكلمنا عليها في الأول، والجزء ده هيبقى responsible for development of urinary system, urinary bladder and urethra. And the posterior part as a result of development of the urorectal septum is the anorectal canal. This yellow colored part is the anorectal canal. This is the stages of development of the urinary part, but we talk about this posterior part of the cloaca, which is the anorectal part, and it is the source of the rectum and the upper part of the anal canal. Anomalies of the hind gut. We have what's called Hirschsprung disease or congenital megacolon. It results in dilated descending colon due to spastic, constricted rectum and sigmoid or absent or presence of aganglionic segments. ده شكله في البريم. تاني حاجة imperforate anus، لأن المفروض الكلواكال ممبرين بيحصل له rupture. imperforate anus ممكن تكون due to failure of rupture of the cloacal membrane زائد anal agnesis failure of development of anorectal part due to incomplete division by the developing urorectal septum. Anal stenosis or anorectal agnesis with or without fistula. Rectal atresia ده شكل imperforate anus or membranous atresia of the anus. Anal agnesis, absence of the anus or the anal canal. Next part in this lecture is about the anatomy of the digestive system. As we all know, the digestive system formed of two main parts. The first part is gastrointestinal tract, and the second part is the accessory organ sharing in the process of digestion and absorption. The gastrointestinal tract starts in the oral cavity or the mouth, then descend into the pharynx. After the pharynx, esophagus will continue forming the stomach. After the stomach, this is the small intestine starting by duodenum, then the scoiles related to jejunum, ileum, then the large intestine, cecum, ascending colon, transverse, descending, sigmoid, rectum and anal canal. All of this part is the gastrointestinal tract, and the digestive system formed of this tract and the accessory organ. What are the accessory organ? Salivary gland, parotid, submandibular, sublingual, liver and gallbladder, biliary tract and pancreas. Main function of digestive system: ingestion, digestion, absorption, elimination. Mouth cavity, the first part of the gastrointestinal tract or the alimentary tract. Boundaries of the oral cavity: check. Upper and lower lip, palate, tongue. Superior boundary and inferior boundary, palate and tongue. Posterior boundary is oropharyngeal isthmus. The oropharyngeal isthmus is bounded by palatoglossal fold tonsil. Superiorly the soft palate, uvula, and inferiorly the tongue. This area is the oropharyngeal isthmus, the partition between the oral cavity and the pharynx. Divisions of the mouth cavity: as we know, the oral cavity divided by the teeth to vestibule of the mouth cavity and mouth cavity proper. Palate formed of two parts. Anterior part forming about 2/3 and it is rough, named as hard palate. Posterior part forming 1/3 and it is a soft palate, and the uvula is elongation from the posterior border of the soft palate hanging downward in the pharynx. This is the parts of the palate: hard palate, the anterior part, and posterior part is soft palate, and the terminal part is uvula. As we all know, the palate separating two important cavity, nasal cavity superiorly from the oral cavity inferiorly. The tongue formed of two parts, the anterior oral part, which is movable, posterior fixed part, which is the pharyngeal part and oral part. Parts of the tongue include the tip, the root, and the body in between. Blood supply of the tongue derived from the lingual artery, which is a branch from external carotid artery opposite to the hyoid bone, passing superficial to the hyoid bone and deep to the hyoglossus muscle, supplying the tongue. Venous drainage of the tongue is through the lingual vein, which drained to the internal jugular vein. Nerve supply of the tongue, as we all know, anterior 2/3 of the tongue, supplied sensory by glossopharyngeal nerve and taste sensation carried through the chorda tympani nerve. The anterior part supplied by lingual nerve. General sensation of the anterior part derived from lingual nerve, associated by taste sensation carried in the chorda tympani nerve of the facial. Posterior 1/3 of the tongue is related to the glossopharyngeal nerve in both taste sensation and general sensation. The most posterior part of the tongue related to the vagus nerve in both general sensation and taste sensation. Function of the tongue: mastication, swallowing, speech, and taste sensation. Teeth: we have two kind of teeth: temporary teeth, which appear at the 6 months, permanent teeth, which appear at the 6th year. The temporary teeth about 20 teeth, the permanent tooth about 32 tooth. ايه هما؟ posterior بيكون فيه third molar, second molar, first molar, 2 premolars, canine, lateral incisor, central incisor in adult. Nerve supply to the upper teeth is derived from upper teeth supplied by maxillary nerve, lower teeth supplied by mandibular nerve. Blood supply: arterial supply of the teeth is derived from the maxillary artery. Maxillary and mandibular, responsible for supplying the upper and lower teeth. This is the mandibular nerve through the inferior alveolar nerve supplying the lower teeth. Pharynx: it is a muscular tube extending from the base of the skull. Beginning of the pharynx is from the base of the skull, termination opposite to the 6 cervical vertebrae, where it continues with the esophagus. This part is the pharynx. The pharynx have 3 opening anterior, or open into 3 structures anteriorly. It open into the nose, it open into the oral cavity, and it open into the larynx. It's formed of muscles divided into 3 parts: nasopharynx, oropharynx, and laryngopharynx. Nasopharynx characterized by the presence of auditory tube or auditory opening and adenoid. The oropharynx characterized by the presence of palatine tonsil, and it lies opposite to cervical vertebrae, the 2nd and the 3rd. Laryngopharynx characterized by the presence of the epiglottis, which obliterate the laryngeal inlet in the time of swallowing, and it lies opposite to the 4th, the 5th, and the 6th cervical vertebrae. Esophagus: muscular tube about 25 cm in length, 2 cm in diameter. It starts at the 6th cervical vertebrae till it bursts the diaphragm and terminates into the stomach. From the base of the skull, it is the beginning of the pharynx till the level of the cervical vertebrae number 6. It is a part of the pharynx. From cervical vertebra number 6 or the C cervical vertebrae, the esophagus starts till it terminates into the stomach after piercing the diaphragm. The course of the esophagus, upper part lie in the neck behind the two trachea and anterior to cervical vertebrae. In the thorax, it lies posterior to the heart and it crosses anterior to the descending abdominal aorta till it pierces the diaphragm opposite to the thoracic vertebrae number 10. It pierces the diaphragm and continues with the cardiac end of stomach. Constriction of the esophagus at the beginning, when it crossed by the arch of the aorta, when it's crossed by the left bronchus, and when it piercing the diaphragm. So we have constriction in the beginning, constriction when the arch of the aorta crossing the esophagus, when the left bronchus crossing the esophagus, and when it pierces the diaphragm. This is the area of the esophageal constriction. Stomach lie in 3 regions: left hypochondrium, epigastrium, and umbilical region. We have 2 shapes of stomach: G-shaped stomach and Steerhorn stomach. Stomach has cardiac end, pyloric end, lesser curvature, greater curvature, anterior superior surface, which is related to left lobe of liver, anterior abdominal wall and diaphragm. So the anterior surface of stomach related to anterior abdominal wall. After removing the anterior abdominal wall, we find the anterior surface of stomach covered by part of the liver and covered by the ribs. Posterior surface related to group of structure forming what's called stomach bed, and they are very important. What is the structures forming the stomach bed? Transverse colon, pancreas, left kidney, left suprarenal gland, spleen. Parts of stomach. Stomach divided to pyloric part and cardiac part. Opposite to the cardiac notch, we can draw a line which divides the cardiac part to fundus and body of stomach. The pyloric part contains pyloric sphincter at its termination or at its junction with duodenum. Blood supply, supplied by branches from celiac artery, and its venous drainage is through the portal vein. Celiac artery supplying the stomach by its different branches and drained to the portal vein. Celiac artery gives to the stomach left gastric artery and hepatic artery, which gives the right gastric artery. The descending gastroduodenal artery, which passes behind the first part of duodenum, will give the right gastroepiploic artery. The splenic artery, which passes towards the spleen, will give rise to left gastroepiploic artery and short gastric branches supplying the fundus. Small intestine. It starts at the pylorus and at the cecum, about 6 meters in length, formed of duodenum, jejunum, and ileum. Duodenum about 25 centimeters and formed of 4 parts: first, second, third, and fourth. Jejunum, which is the middle part of small intestine, and it's about 2 meters. Ileum, which is the terminal part, and it's about 3 meters. Duodenum by its parts: jejunum, ileum, which terminate at the thigh. Duodenum formed of first part, second part, third, and fourth part. You must remember that the second part of duodenum will receive the opening of common bile duct and main pancreatic duct, which form what's called ampulla of Vater and open into the major duodenal papillae. Large intestine. It's about 1.5 meters and it extends from the cecum to the anus. Its parts are cecum, appendix, ascending colon, transverse colon, descending colon, sigmoid, rectum, and anal canal. Cecum, appendix. Cecum is the first part. It blind inferiorly It lies in the right iliac fossa and it communicates superiorly with the ascending colon, medially with the ileum, and posteromedially with the appendix. Yes, the right iliac fossa, and this is the anatomical position of cecum and appendix. Appendix, worm-like tube which open in the posteromedial aspect of the cecum about 2 cm below the ileothecal opening. The length of it is about 10 cm, its diameter about 5 cm, its position in its site in the right iliac fossa, but we have different position to the appendix, which may be retrocecal, the commonest position of the appendix, behind the cecum, pelvic, subcecal, pre-ileal, post-ileal, ascending colon about 15 cm, transverse colon about 50 cm, descending colon 25 cm, sigmoid or pelvic colon about 40 cm and is shaped. This is a descending colon and this part is a sigmoid colon. Rectum and anal canal, the rectum about 13 cm, the anal canal about 4 cm. We must remember that the anal canal controlled by two important sphincters, internal anal sphincter, external anal sphincter. The internal formed of smooth muscle and supplied by autonomic nerves. The external is striated muscle and supplied by somatic nerve. This is the rectum and rectal curvature. The lower part is anal canal. In the male pelvis, the rectum lies posterior to the urinary bladder and separated from it by the seminal vesicles and prostate. In the female, it lies immediately behind the vagina and uterus. The two anal sphincter, internal anal sphincter and external anal sphincter. The internal anal sphincter thickness in the musculosa of the anal canal, while the external anal sphincter from the pelvic muscle. Internal anal sphincter supplied by autonomic nerve, external anal sphincter is voluntary and supplied by somatic nerves. Thank you.